Good afternoon, Minnesotans. Before we get started today, I'd just like to acknowledge that today is the anniversary of the bombing of Pearl Harbor. We have Minnesotans who are family members and survivors of that, and extend our gratitude and to them for all they have sacrificed. We unfortunately passed another milestone, a grim one on this day. Over 4,000 Minnesotans have lost their lives to COVID-19, and over 200,000 Americans every day are now on an average of showing infections. So once again, we are in the heart of the pandemic. I saw today where Surgeon General Adams made note that this surge is different this time in terms of not just PPE and testing, that this is truly about hospital capacity, and it was truly about two things is the way he summed it up. He said it's about our behaviors in cold weather, meaning forcing us inside, and that whether that ability of folks, social distancing, wearing masks, intermingling on events, and that is where we're at. I also know that this continued isolation is always hard enough. It's challenging at any time of the year. It gets very difficult, of course, in northern climates in the winter, and asking people to stay separated from their families, to separated from the things they do, those things all take a toll. And we're here today to talk a little bit, and you're going to hear extensively from Commissioner Malcolm and from Infectious Disease Director Chris Erzman, talking about some of the newest data from the CDC, specifically around quarantining of someone who's been exposed to COVID-19. And I think it's important to understand that, again, when this first started out, we didn't really know even to call this coronavirus, and then it was COVID. The issue was it was a novel coronavirus. I mean, it's one we hadn't seen. And so we could make some extrapolations from past coronaviruses of what would happen, but no one knew for certain exactly how this one would act. How would it be spread? How contagious was it? How fatal was it? All of those things. And over the basically 9 months or so since we've been looking at this, the science has been continuing to evolve around the knowledge we get. So I want to be clear around this quarantining. The science hasn't changed. And basically what quarantining did was, if you were exposed to COVID, that over the next 14 days, the chance of you developing COVID-19 and being contagious to others fell pretty much, the majority fell in those 14 days. What we do know is that the longer you get out from those days when you're contagious to further out, it becomes less. So obviously, the longer you would quarantine, the lower the chance of you spreading it to someone. That still is the science. But what we have found is that your chance of spreading it after 10 days is even less. And it can be, if you're tested, as low as 7. So I don't want to confuse folks when we hear from the experts explain what this is about, but I do think it's important because I hear some of the, whether it's intentional or unintentional, misinformation that gets out there and say, well, they didn't even know and now they're changing it. No, the fact of the matter is a 14-day quarantine is the best thing to do. That follows the science. But the science has been refined enough to say that if we could get more people who were exposed, who felt like they were exposed, if we could get more people to quarantine for 10 days even, that would have an impact on the spread of the virus. And the belief here is that intersection between the science and the ability of people to comply with it to stop the spread of the virus. That has been the whole thing that we've been dealing with from the beginning. And today, after last week's announcements by the CDC of refining quarantine procedures, Minnesota will make sure that we're in line with where the CDC recommendations are, and Commissioner Malcolm and Director Erzman will explain that in a little bit of detail. But I think what's important when you hear these announcements, nothing changes in terms of the things that you can do to stop the spread of this. That's the wearing the mask, social distancing, washing your hands, staying home when you're sick, getting tested if you think you need to. What this does is once, and many of us, myself included, where if you recall early on in April that I was in contact with someone who had this, so I had the 14-day quarantine. Myself and my family stayed in the house, stayed in there for 14 days. That procedure has been through all the way up, and it is still recommended if you are capable and if you are able to do that, to do that. But the changes today will make some adjustments to that based on what we think we get more compliance of. And we also know that being able to quarantine for 14 days, that sometimes comes with a little bit of privilege or luxury that you're able to do it. Other folks are wondering, how do they get back to work? How do they get back out there? And in some cases, and not in many cases, it's those frontline workers that we're losing who are being quarantined. The biggest thing is we don't want people going back out who are contagious and still spreading it. We want folks to be able to isolate and get the care that they need, but this is a refinement to that. So what I'll do is I'm going to turn this over to Commissioner Malcolm to get into some of the details. Director Erzman will refine some of those, and then we'll come back and take some of the questions on this. But once again, for Minnesotans, the science has not changed. It's just a refinement to make sure that we can get higher compliance to break that spread of transmission. With that, Commissioner.
Thank you, Governor. Good afternoon. Well, as the Governor said, we're here mostly to talk about updates to the quarantine guidance, but I just want to give you a brief situation update before we do that. As the Governor mentioned, unfortunately, in the United States, we're now adding, on many days, close to or even above 200,000 cases in a single day. Around the world, that number is about 500,000. 500,000 people every day around the entire world are being found to have COVID-19. And the death rate in the United States continues to be very heartbreaking and sobering, adding 1,000 and occasionally 2,000 deaths each day. The United States is now at 282,000 total deaths. Here in Minnesota, we're reporting an additional 5,296 cases today. That follows 5,582 reported on Sunday and 6,330 cases on Saturday. That's more than 17,200 more Minnesotans newly confirmed with COVID-19 just in the last 3 days. We're at a new total now of 356,152 cases since the start of the pandemic. This puts us on a pace to hit 400,000 total cases within. And we do continue to see very sobering numbers of additional deaths from COVID-19 here in our home state. We reported another 21 deaths today, as the Governor said, bringing our total to over 4,000. This followed 64 deaths on Sunday and 75 on Saturday. So I just want to acknowledge that we have seen some improvements in the last couple of weeks. We've talked a lot about the fact that day to day the numbers can fluctuate quite a bit, but we are very grateful and we want to credit this to Minnesotans having taken very seriously the trends and the Governor's executive orders asking us to pause to try to reset and give breathing room to our hospitals that are still seeing extremely high volumes of patient need. But we are grateful that the numbers have moderated a bit in the last 2 weeks. However, we just need to point out that it's really in the next few days, this week, that we anticipate seeing any effects from Thanksgiving. So while we're extremely happy that the rates have moderated in the last couple of weeks, we have our eyes very sharply on what may be emerging in the next couple of weeks. So again, we're here mostly to talk about the quarantine guidance update from the CDC last week, which we have now had a chance to look at the detail in the data in the CDC and adopt with some specific caveats for Minnesota here. Just want to review a couple of the key terms that you've heard over and over again, quarantine and isolation, just to remind folks that both of these are very critical tools for fighting the spread of this infection, which we know now, and this is one of the big things we've learned since the beginning, that transmission among people without any symptoms is playing in the spread. And while both concepts of quarantine and isolation have some similarities in that they fundamentally about keeping you apart from others so that those others don't get sick. The key difference really is that we use the term quarantine when a person has a known exposure with a high-risk contact with someone who has been found to be infectious, but that person who's been exposed is not themselves showing any symptoms, nor have they tested positive, and that is the quarantine reference. And that's different from isolation. A person goes into isolation when they themselves have tested positive for COVID-19. So in the first case, it's about protecting people from potential exposure before there is a known positive. Isolation means the primary person has been tested positive. And for months, as the governor said, CDC's recommendation, followed by Minnesota and pretty much every other state, has recommended a quarantine period of 14 full days for those people who'd been exposed. And that is because, as the governor said, we know that a person can develop COVID-19 for as many as 14 days after first exposure. That's how long the virus can linger in the body before taking hold to a level where it can trigger symptoms or a positive test result. And while, as the governor said, that full 14 days does remain CDC's primary recommendation for the greatest possible protection, they did announce an update last week to that longstanding guidance. Having reviewed the data and the implications of the degree to which infectiousness changes during the course of that 14 days, they have now given states the option of shortening quarantine guidance under certain specific conditions. And on the plus side, as the governor said, the evidence is quite clear that the risk of a person becoming infected while they are in quarantine is highest in the earliest days of their quarantine, and their risk of being infectious tends to wane as that 14 days goes by. So the hope here is that by shortening the quarantine period, by trimming off just the last few days, when the risk is significantly lower, that will make people more likely to actually follow the guidance to the end. And it can also mean, very importantly, fewer quarantine-related disruptions to people's lives and those of their family. So in that sense, better compliance with a slightly shorter quarantine recommendation can be a net gain from a public health perspective. But it doesn't come risk-free, and that's important to say. The risk does go down toward the end of that 14-day period, but there is still a small risk. So theoretically, a person coming off of quarantine early does present some additional risk for transmission. But people can knock down that remaining risk by continuing to monitor your symptoms through the full 14 days is very, very important. And even minor symptoms that we now know can be associated with COVID-19 should be taken seriously, even a headache. If you are someone coming off of quarantine after 10 days, please be really vigilant in watching for symptoms. And even if you have something quite mild, consider that a potential warning sign that indeed you might have COVID-19, and go remain in quarantine and get tested. So we could have decided, as Minnesota, to just stick with the full 14-day quarantine, which again CDC has said is or we could choose to adopt the new guidance, which we have done after careful review by our epidemiologists. So we want to turn it over to Chris Ersman at this point in time, and she can talk you through a little bit more of the process that we used and our recommendations. Thank you.
Thank you, Commissioner Malcolm. As Commissioner Malcolm said, CDC still emphasizes that the 14-day quarantine period is the safest recommendation. However, there are certain conditions under which people can consider going with a shorter quarantine. If you had a high-risk exposure and need to go into quarantine, shortening the quarantine period from 14 to 10 days after your last exposure can be considered if you have not tested positive for COVID-19, you don't have any symptoms, and you will continue to watch out for possible symptoms through day 14. You also need to continue to mask, maintain at least 6-foot social distance, and follow other prevention guidance. And you are committed to isolating and getting tested if you develop any symptom. And as the commissioner said, we want people to be very careful and consider any small symptom in that time frame, simply because we know that there is still a small risk for individuals from day 10 to 14. So we want to make sure that we're not missing anything. So please, if you find yourself in that position, any symptom means you should go back into quarantine. The updated guidance for the quarantine period can be shortened to 7 days if the person meets all the above conditions and has a negative COVID test result, so long as that was a PCR test, so a saliva test or a swab of your nose and throat, and was conducted at least 5 full days after your exposure, after the start of your quarantine period. So you have the option to go from 14 to 10 days, and in some situations, you could go to 7 days, but that's only if you have a negative test that was conducted at least 5 days after your exposure. In this scenario, the person may return to regular activities if you do not have if you do not have symptoms, and you continue again to self-monitor through day 14. You continue to mask. You maintain 6-foot distance from others, and you follow other preventive guidance. So there are options for people, but it does require a great deal of individual responsibility to make sure that you're attending to all of our mitigation measures, that you're watching closely for symptoms, and that you're committed to isolating immediately if you do develop any symptoms. Now, there are some scenarios in which shortening the quarantine is not recommended, and these are those scenarios. If you have a household exposure, we would not recommend shortening the quarantine, and this is because it's difficult for household members to quarantine separately from other household members, and it's particularly a high-risk situation for or if you're in a congregate living situation, including a long-term care facility, a correctional facility, a homeless shelter, or other situation like that where you're living with other people. In these settings, it can be very difficult for people to quarantine individually, and there's a higher risk of exposing multiple people, particularly people who are at risk of severe disease. So those are settings in which we would not recommend shortening the quarantine. Or if you're someone who works in those settings, we would also not recommend shortening the quarantine, again, for the same reasons. So our guidance for healthcare workers at this point is that they not shorten the quarantine period. This is something that we are continuing to have conversations with related to healthcare workers with our partners, because we know that staffing is a challenging issue, but at this point we are still saying that healthcare workers need to quarantine for the full 14 days. And we do have guidance on our website if a facility is experiencing staffing shortages or other challenges. And so we would encourage people to look to that for guidance. And with that, I will be happy to turn it back to the governor.
Well, thank you, everyone. And this guidance will be out on MDH's website. It will be out in easy graphics through social media and other things that we'll do so that Minnesotans can hear this. Again, I think that default position, if you have the capacity to be able to quarantine, should you be exposed, to do so. But these are some ways to make sure the compliance rates go up. And before I take questions, I would just note, we've said all along, as we learned about COVID, there's certain things that we can't control with it, but there's much of what we can control with its spread. And I'm just struck by, when you compare different parts of the world on how they've approached this, how very different that is. And they're experiencing spikes too. For example, I saw in Korea today, South Korea, they're experiencing a spike again. But I think they're really a good case study of, if you try and attack this a certain way, the results you can have both in health outcomes and economic outcomes are pretty staggering. South Korea is a country of about 52 million people. They've had about 38,000 cases. We had that in about a week. That's since the beginning of this. They've had 549 people die. We've had that in the last 2 weeks. And this is a highly urbanized, highly industrialized nation that chose to take social distancing, masking, and public health advice seriously. And because of that, they are now, and the words they use today is they are in a COVID war zone today because they had 615 cases. We just reported to you over 5,000 in one medium-sized state. So I think sometimes this idea that each state is putting on these drastic measures and it's just uncalled for or whatever, the fact of the matter is if these policies are followed closely on the front end, the implications would have been dramatic. It's stunning to me that a nation 10 times bigger than us has 10 times fewer deaths and has 10 times fewer infections, and their economic output was able to respond quickly. So I ask, when you hear these public health guidance, we get back to this again. You get asked, what are you going to do about a mask mandate? How do you enforce the gathering limits in your homes? What are you going to do if somebody doesn't comply to this? What if you do if somebody travels on an airplane and they're infectious to somewhere else and come back? The fact of the matter is we really have to believe in that social compact and care for our neighbors, that these decisions and things we're putting us. But our best guard against this is people's willingness to follow that. So with that, take some questions. Theo. Is it going to be? Yes, of course, yes, and I think that's when I'm going to have Chris come up here. Absolutely. That's our biggest concern, that we want as simple as possible. So here's what I would say again. They're going to tell you the specifics on this. The goal of changing this is really to get increased compliance. But what I worry about is when people hear something, they get solidified in, and then if anything changes past that, that's then used as a reason to not believe it. So that's why I started out with saying the science has not changed around this. We're changing some of this for social compliance reasons. And Theo's question was, aren't you worried this is going to be confusing? Yes, I do worry a little bit about that. We'll have a campaign to try and put that out. But here's the thing. If you're worried about this to be confusing, drop back to a couple simple things. Wear a mask all the time when you're out in public. Wash your hands. Socially distance from people. And if you feel like you're ill, get a test and stay in self-quarantine until you figure out where that's at, and then it may turn into isolation if you have it. Again, the rest of this is important to know, and this is really, I think, important to know for folks who the economic hardships of it, the inability to be able to do this, the isolation piece, to try and make it a little easier. But again, if there were a baseline, and Chris, correct me if you're wrong on this, I think it would be our hope that you would quarantine for the full 14 days if you're able to. So.
Thank you, Governor. We do not have clear data to say that, 50% of people followed the full quarantine. But what we have heard and what we do know is that we get feedback all the time about the challenges of following the guidance. So we know that people are having difficulty in our various teams that are working with different subsets and different sectors. It has been a challenge. So our goal is to increase the compliance at the point when people are most infectious. So to simplify it down, 14 days is best. You can cut it down to 10 days if you promise to monitor for symptoms, wear a mask, socially distance, wash your hands, and if you do start to feel, sick in any way, you isolate and get tested. You can drop it down even further to 7 days if you wear a mask, you socially distance, you wash your hands, you monitor for symptoms, and you've had a negative test. And the reason that we say that that negative test has to be at least at day 5 is because we want to make sure that there's been enough time for your body to develop some level of virus in your system to be detectable. And so we want to make sure that your negative test is really negative, and then we're willing to let you, reduce your quarantine, but only, again, if you follow those symptoms. So it's really 14 is best, 10 can be done if you follow all the rules, and 7 can be done if you have that negative test. So I think that helps to make it a little bit simpler, and I hope that's helpful to people. Sure, that's a good question. The reason that we've said that we're not recommending reducing the time in a household setting is just because it's oftentimes very difficult to have someone truly quarantined. We would want it to be a situation where they're using a separate bathroom, those kinds of things. And so if you're not in that kind of a situation, then it's difficult, and that's why we're saying we would still recommend the 14 days. So it's not that it absolutely couldn't be done, but it requires a lot of ability to have quarantine within a household, and that can often be really difficult. And so that's why we're saying, as a broad statement, you know what, household exposures are more challenging, and that's why we would just generally recommend 14 days. Right. Well, what we recommend is if you have one child, let's go back to that 14-year-old or 17-year-old that you gave, and they had an exposure to a friend, okay? So now their friend is positive, and the 14-year-old has now been exposed. They need to quarantine. Their whole household doesn't necessarily need to quarantine. They need to be in their bedroom. They need to have a separate, bathroom, those kinds of things. But what gets challenging is if that 14-year-old is now the case, and so you have the rest of the family who's exposed, and now they're saying, well, we really want to shorten our quarantine. We're saying, you know what, it's really hard in those kind of situations, and it's probably going to be even harder to keep from being re-exposed to that person. So that's why we're recommending that in household settings that you really stick with the 14 days. Well, certainly if an employer says we want to make sure that people are quarantining for the full 14 days, they can certainly do that. In terms of the return to work, I mean, really, these people are not ill. So I think this would be a different situation if these individuals had COVID, and then we'd say it really is dependent on their health status. But if these are individuals who have no symptoms and are willing to follow the guidance, then I think that's reasonable for an employer to do that. If the person says, hey, I've got a headache, I need to go home, I need to get tested, I need to isolate, the employer does need to respect that, because we're talking about a situation in which the individual has the potential to be infectious and has the potential to still develop disease even after that 10-day cut point. Yeah, we have said in those settings we want people to continue to follow the 14 days. So for congregate situations, so homeless, long-term care, we do want them to follow the 14 days. And for healthcare workers, we are still asking for following the 14 days, but we are in dialogue with our partners in healthcare because we know that staffing is such a great challenge for them.
Yeah, we were just discussing, and some of you got familiar with these folks early on because they had some of the early modeling at the University of Washington, the Institute of Health Metrics and Evaluation. I believe Jan is correct, the folks on there. One of their lead researchers is actually a Minnesotan. So we talked to them once in a while. One of the metrics they use, and they present a slide deck to us that's massive about all the interactions and predictions, to be very clear, where they think we'll end up from cases to deaths, you know, before we get a high number vaccinated. And one of the metrics they use in there is mask compliance numbers. We're at about 72% of folks who, again, now keep in mind, this is self-reported. Do you wear a mask at all times when you leave the house? And 72% of Minnesotans said yes. There may be public pressure, I guess, working both ways on this, much like you see in political polling, whether you want to say you did it or not. I think that there's little doubt, and I saw Dr. Birx on Face the Nation yesterday, masking helps slow the spread, and that's pretty solid. The more you wear the mask, the more you can increase that. I certainly do believe that in Minnesota, by wearing the mask, that we have reduced the spread of it. It is the most cost-effective and the easiest way to and so I think when you make these measures, you do need to think about what you're getting in terms of health compliance and health data versus the cost it means in terms of 14 days of self-quarantining, shutting down businesses. What is the gain you're getting out of that, and how do you figure that cost-benefit analysis? I still certainly believe that the best one in this is certainly masking, and the case of in masking is one of those, it's not true, but even if you were wrong, you don't really lose anything by doing it, and so I think that's why we're encouraging, but the data is pretty solid. Jan, if you want to follow up.
Yeah, Governor, I just wanted to add that we do have some survey data that suggests, and I think you've heard us talk about this before, that Minnesotans are doing a better job wearing masks when they're in public settings running errands, but they self-report that they are less vigilant about mask wearing when they're in social gatherings with friends and family in their own home. So I think we do see, and you know, Dr. Birx mentioned that when she was here last too, that there's just an observable difference in compliance with these mitigation measures between public settings and private settings, which is why, you know, the emphasis in recent weeks has been so much on making sure that we know that just because we're hanging out with family and friends doesn't mean there's not a risk of transmission. We don't know any data to that effect yet. This was this survey data that Chris just handed me was from late September and early October. So when that particular survey is repeated, we'll certainly ask that question again about the distinction between social gatherings and private.
Deadline.
Yeah, no, this is good. It's the witching hour, if you will, a lot of things coming together, and this is not all that unusual in deliberative bodies. Incredibly frustrating to the public, and I think now, especially at a time where speed and sense of urgency is really needed. I spoke extensively with several of the Midwestern governors, as I said last week, with Speaker of the House Pelosi and some of the members of the Senate. I'm feeling relatively hopeful that the federal government is going to move a relief package that will make a difference. I'm also very hopeful, and I was on with Democratic leaders this morning discussing where we're at in their negotiations with their Republican counterparts in the House and Senate to try and move something for Minnesota. I think, you know, there's always differences and you're debating things out. I think one of the things that's happening here is everybody's looking out of the side of their eye to what's happening in D.C., and it's probably not a wrong assumption to say, well, if Washington provides what they should have many months ago in help to businesses and help to individuals, will that change the calculus of what Minnesota should do? Yes, it will. But I'm kind of at the point now where we started this several weeks ago because I don't know if they're going to get it done. I'm more hopeful than I've been, but it doesn't change the fact if you're that small business owner or that person who's worrying here about unemployment insurance running out, I think it's absolutely critical that we at least provide the safety net now that we know we can get done. So I would have to tell you, Theo, the way the timing's looking on this, we are going to certainly have to have a special session on dealing with the emergency powers the 14th. That's next Monday. If they are able to finish a package today, I would think it would make sense we call them back tomorrow to do it. I don't think that can be done, or that might be unrealistic. So one way or another, I think probably as far as these deadlines, since I was in Congress and seen this long enough, I think they're close. I think it's going to get done, but they never, ever can just do it without one more hitch. So this is my prediction to you for what it's worth. They're going to do a continuing resolution this week, kick it to next week. They're going to try and pass an omnibus with this package next week and then go home for Christmas and the holidays. Where's that leave us? I think we get ready. We try between now and next Monday to get a package done. We look at next Monday of being the deadline to do a package for Minnesota, and you can write it in such a way that if, say, for example, we extend unemployment insurance through the state and the federal kicks in, then that can just that can take the place of it. There's ways our legislators can think of that. So I think that's where it's coming. And then I think in addition to your next question, we want to give as much lead time as we possibly can. I think Commissioner Malcolm's right. We're going to start to see numbers be reflective of what happened over Thanksgiving. Again, to knock on wood, we're at a higher level, an unacceptably high level, but the commissioner's right. The pattern over the past several days has been a plateau. But again, the lagging number will be hospitalization versus the cases. With that being said, it is our hope to try and provide some guidance around mitigation efforts by the end of this week, so that those folks will have a week in advance. And again, fair enough to say that's really, really hard to adjust your business in that short of amount of time. But as I've said all along, it's not our timeline. We can adjust the virus's timeline by our behavior. So. Well, I think it'll depend on what results we got out of this. Obviously, if we start to see death skyrockets, and again in Massachusetts, they're building field hospitals in open fields. We're seeing a full-fledged crisis in many states. We certainly aren't there at this point, but we're still at a very tough space in terms of where we're at in our hospitals. That will be one of the determining factors. I think this week should start to provide quite a bit of guidance just because of the nature of that incubation period or whatever that we're going to see. It's now been 11 days since Thanksgiving. We should start to see some results of that.
No, it's pause. I could work.
Well, that goes back to where Theo's at, and I'll maybe on this, Esme, we should pull up the tape. I think I've been more careful from this. If I said that 2 weeks ago, I said we would begin to see, because it works over this time, because you're not going to see it before that time. The one thing is, I think it's very careful of. I think people need to be very careful about ascribing causation directly to something. That is much more difficult and hard to prove. I'm not going to, if we do get a pause in this, I'm certainly not taking credit for it. It will be because Minnesotans adjusted their behavior. That's the whole purpose of this. The question that we will start to see, and that was in response to Theo, was that coincided with going into Thanksgiving, the Thanksgiving holiday. Now, here's what I do think. I think prior to Thanksgiving, Jan, correct me if I'm wrong, that we were starting to see a plateau and a curving. Now, whether that was directly related to the mitigation, that's probably a debate that will happen for the next 30 years in PhD papers that will be written about this. But I do think we certainly were starting to see some of that start to become a little more manageable, where we're still not climbing. The question I think we're all asking is, will that plateau start to come back up again because of Thanksgiving? And again, we should, as I said, we should start to see that about right now, and it could extend another 2 weeks. And so those will come into decisions that we're trying to make about what mitigation efforts. You've seen, if you don't, I think you've seen states where they've shut down pretty much everything because the spike went higher.
Okay, holiday plans. I understand holiday scenario with
I think so. That's our effort to try and do so. And again, to Minnesotans, this is the virus's timeline, but people live in the real world. As I said even a couple weeks ago, just the direction we're going, I think the most challenging thing is there is every reason to start getting pretty optimistic about the vaccine and some of those. But I also want to remind people, the vaccine rollout and the reaching the critical mass of the number of people vaccinated is going to take months. It's not going to happen when the first needle goes in an arm here in a week or so. That's just the very beginning. And so I think when you're seeing this, of 5,000 cases, hospital capacity up, an average of 30 or 40 deaths a day, we're going to have to mitigate. And again, the option is not to just not do anything. Again, we know that when you don't do anything, it really is that pressure on the hospital situation and then the avoidable deaths that will start to happen. Not to mention, I still can't stress this enough, we don't know about the long-term effects of a COVID infection among certain populations, and it makes sense to everyone being this close to a vaccine to try and reduce those infections the best we can. But we should start to have a pretty good idea by this week. And again, I think I can safely say this. I don't think that the 50 states in this country are going to open up and people are going to fly unmasked and have massive holiday gatherings. That is not going to happen, nor should it happen. The question will be is, where are we at in this country and what are going to be the recommended direction that people should go? People traveling back and forth, yeah. I mean, 9 months into this, and I think, again, there will be an after-action review, I would hope, as a nation, as a state. We will certainly do that. You know, those behaviors impact others, and I'm hearing people, I heard Mike Osterholm today talk about, you know, letting people know that the average is so strong they don't want to put somebody else at risk or kill them, but the fact of the matter is those types of behaviors are incredibly risky, and they have an implication of infecting others that could be pretty dangerous to them. So again, this has been a horrific 9 months for the country and for the world. It has fallen heavily on healthcare workers and communities of color. There are now 4,000 people with families spread to all corners of not just this state but this nation who have someone who died from this. I just would, again, if we're getting close here, just dig deep, wear the masks if you can, socially distance, try not to gather outside your own family, and let's get this thing done. And so I don't know what to say about that. I see people on TV, you know, talking unmasked in large crowds. You know, we see people openly telling people to disregard these health mitigations. Again, they're not my ideas. I'm not trained in this. I listen to the epidemiologists. I listen to the experts in this, and then I watch what's happening both here and around the world of what seems to work the best, and then try and implement them, all with the goal of stomping this thing out, and that's the fastest way to get our economy going. So I don't know if frustrated is the word. I'm disappointed when I see some of it, that there's just an attempted disregard. And again, I saw Dr. Birx, and she, pretty solid and been through this a lot, was pretty frazzled over the weekend of, we're still debating whether these mitigation efforts work. Are we still debating whether this is the right thing to do? And I think I would say there were several different ways we could have gone about this. One would have looked more like South Korea, where they have a healthy, vibrant economy and people were pretty much back to normal, and they have fewer deaths than a medium-sized state does, even though they have 10 times the population. And they did it in a unified national manner, and we took a 50-state approach. Again, I would just end with, I'd just love to see some national leadership right now We're dying. We're dying by the thousands. People are getting infected. Our hospitals are overrun. We're deeply concerned how we're going to get the vaccines out and all of that. And we're not really hearing much. And I think that's unfortunate. So I would just tell you, Minnesotans, this has been horrific. And it's 2020, and we're living through a once-in-a-century pandemic. Our science is good. We've got smart people. We have the capacity to impact this, but like so many things, it really comes down to our will to choose to do this. Again, I can't just tell you the easy or convenient things. I have to tell you the reality of where things are at and try and get the best compliance we can to get to a point where we protect our neighbors and we get back to normal. The good news is we're close, but the challenging news is this. The hardest weeks, I think, are still ahead of us. I think the most challenging weeks for our hospitals are still ahead of us, and it's also the most difficult time to be away from your family, to socially distance, and not to do the things we like to do. It is an absolute convergence of the worst possible things at one time, and the only thing I can say to you is, if we do these things right, it's only a short matter of time till we get into the new year and head towards spring that we get a handle on this thing and get back to the things that we care about. So I want to thank you all, and I believe tomorrow we will have a more extensive presentation on the early stages of vaccine distribution and plans for the state of Minnesota, and then we will be back in this room with, I believe at this time, check, a bipartisan legislative executive group to answer questions of doing this as a Minnesota plan together. And again, if I'd leave you on a high note, it's been too long since we've talked in a bipartisan manner and stood together on COVID like we did in the early days of this. It's my hope is that we are bringing that sense of one Minnesota tackling this together back to you in terms of where we go with the vaccine. So I think tomorrow should be an opportunity, Minnesotans, for you to see a unified state and get to see the data that we have in the early stages of the plan to start vaccinating, how we're going to vaccinate, who we're going to vaccinate, what that will look like, and kind of a preliminary timeline of how it will stretch over the next few months. So look forward to speaking more about that tomorrow. Thank you.